excited to be able to introduce these four incredibly intelligent women as we talk about something that is going to impact every single one of us in this room, which is unfortunately aging. We all age every now. We just did, right? And one of the things I'm particularly proud about, at John Hancock, we're committed to helping people live longer, healthier, better lives. And a lot of what these ladies are going to talk about is obviously the larger ecosystem of things that impact aging and longevity. And amongst that is community. And each of these ladies have a lot to say about that. So I'm really looking forward to their comments. So with that, I will turn it over to Anna Kuchman.
Thank you so much, Matt. Hi, everyone. Welcome. I'm Anna Kuchman. I'm the health editor at the Boston Globe. I'm so pleased to be joined today by all of you for a lifelong battle, health, equity, and aging. And I'm really happy to be joined on stage today by Rachel Brody of Ariadne Labs, by Milagros Abreu, who is the founder of the Latino Health Insurance Program, and Latrice Best of Boston College. Welcome. Thanks so much to each of you for joining me today. I wanted to ask you to start by just talking a little bit about the work that you do as it relates to aging. Maybe we could start with Rachel and go this way.
Hi, it's really nice to be here. Thanks for coming and for inviting me. I work in hospice and palliative care. I'm a medical director of a small community-based hospice in Western Mass, but also work at Ariadne Labs, which is a joint health systems innovation center at the Harvard T.H. Chan School of Public Health and Brigham and Women's Hospital. And I like to say that I work in unhealthy aging, that I'm really interested in how to age well or feel good while you're living with disability, chronic illness, cognitive impairment. And as we were just saying, if we, hopefully, we're all lucky enough that we'll be able to age and to try and help people do that as well as we can.
Well, again, my name is Dr. Milagros Abreu. When I started my career in medicine and research, I identified that many people from Latin America and African American communities didn't have medical coverage, and especially for the older population, or they were also lacking social services. I was able to found this organization in 2006 with the main goal of improving access to care, improving access to food, and the health literacy of community residents, especially from minority countries. We have a wonderful staff where we deliver multicultural services, especially for the older adult population, based on their lack of information and their background. We do provide assistance with clinical care. We do also provide help with applications for social services such as SNAP, and we do also provide health education. I think this is one of the most important issues facing our older adult community is the lack of information about how to manage and control conditions such as diabetes, hypertension, some type of cancer, and also to make the living with high quality. So thank you for having me.
Hi, I'm Latrice Best. I'm an associate professor of sociology and African diaspora studies at Boston College. I'm a social demographer, social gerontologist in training, and so most of my research has looked at sort of the interplay of biological, social, and sort of environmental factors and how they play themselves out across the life course with particular interest in aging. And so kind of to the point earlier, I always tell my students, you start aging once you are born. So I cover not only sort of in my aging classes and what have you, sort of the chronic health conditions and some of the experiences later on in life, but I really talk about in my work how early life conditions, whether social factors, economic issues, social relationships, other types of psychosocial characteristics, how they play themselves off across the life course and lead to divergent health trajectories. And so some of my more specific work has looked at sort of the intersectionality of sort of the aging experience, particularly I'm looking at some work at Ghana, so larger work on looking at disability disadvantages of women, but also here in the United States, I'm actually trying to shift a bit and thinking more about policy. And so thinking a bit more about the intersections of intergenerational justice, environmental justice, and how we can actually harness some of those frameworks to really think about critical race theory, other sort of very seminal pieces in sort of social sciences, and think about ways in which we can come up with frameworks for researchers, but also with policymakers, and thinking about how we can actually look at the most vulnerable populations, which is the younger sort of populations, but also older adults, and how we can actually galvanize them in terms of thinking about their health and climate change and environmental justice issues.
Thank you so much. I wanted to start by talking about, based on your experiences, what are the key ingredients that you think need to be in place for people in a community to age well? Any of you can take that.
I guess as a sociologist, so that's what I like to talk about, to really sort of think about built environments. And so I would actually say structurally, a lot of the research and the things that I've studied have looked at structural factors. And so we think about individual characteristics. I think back in the green we were talking about sort of understandings of non-compliance with diseases and sort of thinking about sort of public health and sort of clinicians' interactions. But what I'm also very interested in terms of thinking about what things in the community, particularly as people age, set them up for sort of poor health, but also can actually set you up for a more advantageous sort of life course and sort of a good sort of end of life. And so in terms of thinking about some of those characteristics, economic issues are very important, socioeconomic issues, particularly across the life course, as well as thinking about access not only to health care, but also access to greenery spaces. We have research looking at how that is very important, particularly in terms of thinking about areas of health and well-being, as well as sort of one of the things I'm really sort of interested in terms of social relationships, and so social connectedness within different communities. And so research has kind of shown, and I think most of us kind of have heard recently about sort of social isolation and loneliness being very sort of a flashpoint right now in terms of thinking about health inequities. And so those things to me are really sort of important in what I've seen in my work.
Thank you.
I love to add to that, just to build on what you were saying, Dr. Best, this idea of social connectedness and also belonging, and I think belonging is huge as a way to think about individually, like what I need as a person, but also socially and how we're seen in the world that we're in. And some of you probably know this work of The Blue Zones by Dan Buettner, which we've talked about before as a group, but looking at places in the world where people were living to greater rates at higher ages, so more people living till they were 100 than other places in the world. And the things that really help people live well were social connectedness, feeling a part of a group, having a role, having a job, having agency and autonomy over your life, right? Not being powerless, as well as being active and eating things that were natural in their environment. There wasn't one specific diet, but sort of eating the foods that were in the world that you were in and being a part of preparing those foods and preparing them with people. So I think there's a lot to that. And the flip side of what you're talking about is what we can see is where that's missing for so many people right now.
Recording in progress.
Yes, I just only wanted to add to everything that my colleagues are mentioned is how the difference between biological versus chronological age. So our age, I would like to take 10 years from my age, but we can. But biologically, we can do it with making changes in our behaviors and also our environment. So if we have the opportunity, because not everybody can have the same access to healthy food, if we can have the opportunity to increase access to healthy food, access to care for everybody in the community, especially those who are at greater risk of developing conditions or dying for conditions who can be considered preventable. We definitely believe that social connections, I heard from everybody in the panel, is important. And also our cultural beliefs and backgrounds are also important to preserve, especially when we are coming from other countries. Sometimes we don't want it to maintain them and change it. And sometimes those are really important for us to maintain our health. So I just wanted to add that.
Great, thanks very much. What are some of the biggest barriers to aging well, and what populations tend to be at a disadvantage?
I can start.
This is Laura. I'm just joining.
I
Just
can-
wanted to be here as support for Allison, but I
They
can hop
want me
off
to
I think all of
talk.
our,
as soon as we start.
all of our mics died.
Yeah, okay.
Okay.
I can start to saying that we have the fortune of being one of the states with the highest, technology, medical, treatment, diagnostic, and public health. So everybody can hear me?
Hi,
Okay.
Allison.
So, and the public health, services that we have in Massachusetts. So we are fortunate. However, not everybody have the same opportunity. So we wanted to make sure that when we're talking about equity in health and aging, we have access for everyone to receive the same opportunity to
How are you,
aging
Allison?
well.
Thanks for hopping on.
So wanted to just to highlight that some population,
How is Dallas?
Latinos,
Getting
African
ready?
American, and you name it, they are being impacted the most for chronic diseases such as diabetes. I wanted to give you an example. So diabetes is one of those conditions that the prevalence is higher
she's
among
frozen
those
too.
populations. And diabetes, they say that among those populations, 9 out of 10 people have prediabetes, that they don't know it. And in terms of Hispanics, 1 out of 3 people from Hispanic community have been diagnosed, have the disease, but they don't know that they have it. So those type of data and research show us that these populations had a higher risk for complications. And also, as we mentioned, conditions like diabetes can be deteriorating individuals' life, impacting tremendously their quality of life. So they can develop complications such as blindness, amputation, and also kidney failure. So conditions that can be debilitating and disabling individuals as well. So I wanted to say that across the board, we need to pay attention for this type of condition that can be considered preventable. I also wanted to say that some type of cancer can be preventable as well. And we need to pay attention to populations that despite that we have so many opportunities, they don't age as well.
I guess to piggyback onto that, in terms of particularly like diabetes and other chronic health conditions, disability, in terms of thinking about the sort of ramifications of those conditions are very stark by racial ethnicity, particularly Latinos and African Americans, and even here in a place like the Commonwealth. And one of the things I always kind of think about with sort of thinking about sort of aging and sort of active life expectancy and things of, you can age, right? But you want to be, you want to feel well, and you want to sort of be free of disabilities and other types of issues that may hinder your quality of life. And so I think disability, and so that can actually lead to cascading events as it relates to transportation issues in terms of barriers for older adults, as well as sort of what we kind of call spatial mismatch in terms of where you live versus where you need to see a specialist, for instance. And so those can actually be barriers when we're kind of thinking about some of those chronic health conditions as well.
Yeah, I think aging exacerbates all the social determinants of health. So anything that's sort of on that list is, times 100, because it is just that much more difficult to navigate a lot of those worlds physically, cognitively. But the other piece of this, I think, is care workers and caregivers. That there's a huge burden of unpaid caregivers, particularly in the Black and brown communities, that are sort of unseen, undervalued, that's contributing to health losses in a much broader scale, like people not being able to hold down jobs or be active and engaged in the way they want to be because they're having to provide care. So I think you can't really talk about aging and who's aging without also talking about the caregiving that's required for the population.
Thank you. This isn't something that we'd previously discussed, but I wanted to also just ask about the impact of finances on aging. Because even though in Massachusetts we have virtually universal health care coverage, surveys have shown that something like 44% of Massachusetts residents still have trouble affording their health care. And I was wondering how that impacts the populations that you work with. Maybe Dr. Abreu?
Yes, this is one of the programs that we are focusing on, especially for our older adult population. I know that you all are heard about the CHIME program and these other resources that are in the community. And for populations, especially I'm talking about, in this case, Hispanic, because one of the population who have the lowest insurance coverage rate, they are being also those lack of coverage, or also we can mention not only the uninsured, but the underinsured among the older adult population. Because sometimes you need to pay for co-pays, deductibles, and these other things that doesn't make sense for any individual who's really working in those areas. Imagine you being an older adult surviving from Social Security that you still need to pay so co-pays related to your prescription that help you to live your life. So we need to make sure the access to care by helping individuals to apply is a process that can be easy. Well, but if the person cannot do it by themselves, at least connecting to the proper organization and resources that the state provide, so they can get help to apply for coverage. So in some of the statistics show that, especially for the Hispanic community, they are most likely to be uninsured than the rest of the other racial or ethnic group. They also have the tendency to not using primary care services for the past 12 months. They rely most on using emergency services because of lack of coverage. And finally, they are most likely not to understand how to manage their conditions. So adding all those elements can really affect, the way that you are aging. And just to give you a sample, we recently passed, or still passing COVID. They were also in between Hispanic and African American, the most impacted by this infection. So older adults, especially those 65 and over, we do also recommend vaccination as one of the important aspects of prevention. So prevention all the time, I think, is important.
Thanks. So let's talk about some success stories. I'm wondering if there are any examples that you've seen from your work of communities or organizations that have really done well by people as they age. What models have you seen that seem to work well?
Well, one of the models that we all talked about was PACE. I'm a huge fan, Program for All-Inclusive Care for Elders, which started in 1971 out in San Francisco and at On Lock. And why I love it is it's really a holistic model of care. So it really tries to provide social supports, medical supports, physical nutrition, transportation, but kind of like the whole package for people. You have to qualify, you have to be sort of frail enough, ill enough, or have dementia so that it's not for everybody. Not everyone needs that much care. But for people who do need that much care, it's really great. And what you see is that people get a lot better, not because they're getting a different blood pressure pill, but because all of this stuff is pulled together and coordinated and there's somebody paying attention. And so, the other piece that you were just talking about with the financial stuff is, particularly around cognitive impairment as people age, it's so complicated, right? And so say you do get on Mass Health and you're in some great program and then it expires and you get a letter in a mail, and if you don't send it back, you lose your coverage. And who would know, right? And so I think there's so many ways that our system is set up to not support us all as we age with these complicated little ins and outs, but I'm a big fan of the PACE program.
I think going back to what you talked about in terms of the Blue Zones, and so the Blue Zone projects where they've tried to, across the country, I think it's like 51 or so, where they tried to essentially replicate these, what we see in terms of longevity in these 5 areas around the world. And so essentially you have these communities with different partnerships with local governments. You can have a certified Blue Zone school, certified Blue Zone organizations, and basically trying to actually create a built environment where you can actually have success in terms of building relationships, teaching people how to eat healthy, physical activity. And so what they've seen from some of the results from that is essentially that they've been able to sort of decrease smoking, obesity rates have gone down in certain areas. And so this is something that I think is very encouraging in terms of being intentional in terms of who comes to the table within different communities.
Can I just add, an example of some of those communities, like in Okinawa in Japan? So they share, that they give us an example of how important community social connection and, like we all mentioned, healthy eating and the environment is so important for people to live longer. Some of the example based on this Blue Zone, the women from that particular community, they can reach over 100 and compared to other communities. And we can also reflect with other communities here in the US, I think in California, but we have to understand that there are populations in terms of we were talking about the Hispanic paradox and this other, that we have to understand the cultural and the beliefs of individuals so we can being able to assert with really good opportunity to make impact in safe ways, to educate and to understand by learning and having data, recent data from some of these communities. Because, like, for example, the Latin America, and in the same for the Asian community, we have different subgroups that are some different and diverse, and understanding where they are coming from, who have been aging better based on their socioeconomical access, understanding their culture and these other factors can help us to bring more definition how we can improve the populations that we wanted to serve and that everybody can age on the same way.
Thank you. We're getting some great questions, and we're also running short on time. So let me ask a question from the audience, and then maybe I'll come back and ask a concluding question of my own. So what recommendations would you give to help BIPOC aging populations or their caregivers to advocate for healthcare access or proper diagnosis or treatments?
I mean, what I was going to say is that I think there's a lot of people who are doing this. And so my advice, which is sort of sideways advice, is to find the place that you care about and to engage and support in those groups. I mean, things we've heard about here is the Health Equity Compact. They were talking earlier about sort of Black Americans for COVID. I know that there's Black people for dementia, working around Alzheimer's. But I think, like, once you're within those communities, there are groups that are advocating really strongly. Like, there's already momentum and there's already a movement. So I would find the people who are doing the work and engage.
And I guess one way to kind of find those, not do an acronym here, Little Brothers, Friends of the Elderly. Thank you. It's national, but I know they have a very robust, I've been here for 2 years, so sorry. They have a very robust Boston chapter. And so one of the things that they do is thinking about LGBTQ aging. And so actually bringing together not only sort of older adults, but also people of college age or younger adults in terms of sort of thinking about community, right? And so there's a lot that can be learned from both sides of those age groups, and also giving support to each other. And so that can be another way of actually sort of facilitating and also sort of galvanizing people around advocacy.
I just briefly wanted to add the Aging Collaborative, Massachusetts Aging Collaborative, and also the Healthy Living Center of Excellence. There are multiple groups, and also Latino Health Insurance, now that I'm here. There are multiple organizations that are really devoted to increasing continue this conversation and increasing access for these topics that we are discussing, and also for evidence-based education that have been shown how effective it can be in helping individuals to getting connection, understanding their chronic diseases, and prevent it.
Thank you so much. Okay, we've run out of time, but I really appreciate all of your insights. Thank you all for joining us. I'm going to turn it over now back to Matthew from John Hancock to close us out.
I mean, I think I speak for everyone, particularly for these three, for you, of course, included, but these three brilliant thought leaders in their respective fields. They've kind of opened my eyes to a few different things, and I think I'm actually quite bullish, particularly being here in Boston with a fairly robust community of resources that actually can potentially start acting upon this, be it either medical, nutrition, education, and I do include our commercial partners from the business communities also have an important role to play to activate this within the communities that you all have discussed today. So with that, again, thank you all for the attention, and the following session will begin momentarily. Thank you.
Thank you.